Yep, we all got the notification that you have started the recording.
Yeah.
So did you want to welcome?
Sure. Well, I mean, we've had a couple of minutes to chit chat, but welcome everyone. We were talking about having a space for people to ask questions and connect with each other, because I think just from a lot of conversations that I've had with people, and I know it's been a broader issue, people have found the last week very confusing, a lot of mixed messages coming out, and we thought, you know, if there was a way of people coming together, asking those questions about, you know, things they may be confused about, and having a place where some of those questions could be answered, we are then in a better place to go back to our family networks and other discussions that we're having to hopefully answer their questions. So that was the sort of beginning point of organizing this. So thank you all of you for joining in this weekly forum. This will hopefully be the first of you know, however many we can manage until we decide that it's safe to meet each other in person again. So if you have any, just in terms of some housekeeping, if you have any questions, if you have anything that you would like us to have a conversation about, please put them in the chat function. And then we can, you know, we can include that into the discussion. If for future weeks you would like us to have a particular focus or, you know, topics or themes, then yeah, please let us know. This is a very open-ended idea, and you know, whatever is the, you know, the most suitable forum or platform for people that they're comfortable with, I think is the intention of it. So it's not, you know, that this is the only way of doing it, but it's to help, you know, answer questions and alleviate some of the confusion in the community. So I will, with that, I guess, bring in Dr. Rajiv Jairam, who most people would or should know, I think, at this point, and we can kick things off.
Yeah, sure. Thanks, Charishma, and very much like what Charishma mentioned. It's I suppose what's caught us a little bit by surprise. The situation that is evolving quite rapidly, and I guess from a place where we were, you know, pretty much had almost no restrictions to having quite a few, hasn't taken long at all. And that has brought about quite a lot of anxiety in the community, and also on the back of, I suppose, what's happened in India recently. Those anxieties are also increasing in terms of can there be similar kinds of situations happening here as well. And so I think the idea of this forum was, I mean, Charishma needs to be given due credit for coming up with the idea, and thank you so much. And I think it'll give all of us an opportunity for to come to represent the voices of the communities that we are in terms of discussing the current concerns that come up, and collectively be able to come up with some responses, and so therefore help our community as much as possible in these quite trying times. And these can be exactly the same kind of difficulties that people faced when we had the first set of lockdown over a year ago, or it could be new ones, new anxieties that are happening as well. And so essentially, I think from an overall what we thought for today is that we sort of have a loose agenda that we follow, and it might take us about 10-15 minutes to just go through those points, and then we'll open it up for discussion later. So I can sort of start off, and then I'll hand over to Charishma. So the first one really is around, so what does the situation look like at the moment, and what's happening now? Obviously, some of us are extremely hooked on to 11 o'clock. We set our watches and set our phones to say 10:55, Gladys is coming, going to tell us today's score, and we have to turn on the televisions and turn on to check what happened. And that seems to be a clock on which we function these days. And we're all extremely worried and concerned about the number of rising cases that are happening. And that is the situation at the moment, is that there does occur to be a degree of community transmission that the contact tracers are finding hard to get on top of, and that is the current worry and concern. So the virus is spreading in the community, and it is causing quite a lot of difficulties to a number of families. Just as an example, I'm not sure if any of us know any close contacts or any of us have been close contacts, but in my line of work, having been in contact with people who are considered close contacts, they're all isolated. Some of them, if they cannot isolate at homes, or if they're large families, then the government provides health hotels for them to be isolated in. So there are lots of families that are being displaced from their own homes, needing to go to those specific places. Then the number of people who are positive with COVID, or the close contacts of the people who are positive with COVID, also have other kinds of illnesses and are coming to hospital. And a whole different, so all hospitals, especially Bankstown, Liverpool, Fairfield, have had to develop a very significant alternate mechanisms of managing these people, and we have had to segregate our hospitals into many different kinds of wards and so on and so forth to manage them. It's not only general sort of health patients, but also mental health patients and so on and so forth. So it does bring about a whole significant degree of complexity in the system. And then obviously the step above will be people who are ill with COVID, who need a first level kind of care, who can't be managed at home because their oxygen levels are dropping and they need to come into hospital to require some additional oxygen. And then those whose oxygen levels are dropping to such a significant extent that they need to be moved into ICU. And then a proportion of those in ICU that actually need ventilation and need to be ventilated. And I guess the figures are out today as well. Of all the people that have needed ventilation, 99% of those needing ventilation, or more than 99%, haven't been vaccinated. So the ones coming to hospital needing that high level of ICU ventilation care are all the ones that haven't been vaccinated. And so far, no one that's received both doses is in a critical condition. And it doesn't matter what vaccine. So the severity of illness is not dependent on what vaccine one gets. And we can talk a little bit about the vaccine itself a little bit later, because there are lots of questions about AstraZeneca and Pfizer. And if there are specific questions, we can discuss them and see how best we can address them. But the situation is at the moment that there is quite significant community transmission. Its transmission is occurring in areas of Sydney where general communication doesn't seep in very well. Most people there aren't turning on their televisions at 11 o'clock to see what the government advice is. Lots of people aren't aware of government advice as well, and Charishma can talk about her experiences about people that have been I suppose pinged for not doing the right thing. So it is occurring and also occurring in a place where I think all of us have a degree of influence, in the sense that we know of people in the localities that are significantly affected. We know of people that are quite anxious. So let's sort of look at that in a little more detail. But what I'll do is I'll just hand over back to Charishma to just talk about some of her experiences and in terms of what measures are in place, and then we can talk a bit about the restrictions and the vaccinations. And then subsequent to talking about that, we'll talk about what the potential risks and dangers of an ongoing lockdown can be, and how people can support each other in check-in. And then after that, we'll address any questions any of you might have, and then take it from there. So that's the loose format for today. So Charishma, if you want to share your experience in terms of what measures are in place, and then I can talk a bit about the vaccinations.
Sure. So as we've kind of seen a lot of coverage being directed on Southwest Sydney. For about the last week, there have been quite strict restrictions in place for the local government areas of Fairfield, Liverpool, and Canterbury Bankstown. And as of Friday, those restrictions were also extended to the local government areas of Cumberland and Blacktown, because of the number of cases that were being detected in those local government areas and the potential for further community transmission as a result. The restrictions basically mean that unless you are on a list of exempted workers, and I can put that list in the chat shortly, but unless you are on a very finite list of workers who cannot otherwise work from home. So you're an essential services worker, a health worker, and that sort of thing. You are you must work from home, and you are not able to visit other households. So in the contact tracing and the the work that that New South Wales Health has been doing, they found that the biggest sort of cause of transmission is within households. So once it gets to one person in the house, the odds that it will get to everyone in the house is much higher than with the previous variations of COVID, which is what makes this variation so contractable to other people, and that's what they're trying to minimize with the restrictions that are in place at the moment. Obviously, that has led to a significant amount of confusion, because for the first sort of 36 hours, the only exemptions to to the people who should not leave home were health workers, and that's obviously now been expanded, but as a result, there have been a number of people who have been fined for contravening the health orders. Some of those are because people had no excuse for being outside of their home and were therefore fined. But in other situations, there have been people who were fined for wearing masks, for having a reasonable excuse to be outside of their home, but they were not provided with access to a translator, for example. And so there have been a number of situations where people were fined or were said to be contravening the health orders without without an excuse. I think it's really important for people within the community to understand not just what the restrictions mean for them, but what circumstances there are for them to be outside of the home, so that they're then protected from being fined or facing worse penalties. In terms of the challenge with reaching some of the members of our community who may not be, constantly tuned into the ABC at 11 o'clock every day, there at Liverpool Council, as well as Fairfield and Canterbury Bankstown, have been in very close contact with, the Multicultural Resource Centre. On this conversation, we have Nathan Haggerty, who's one of my colleagues from council, who's also the chair of the Western Sydney Migrant Resource Centre. And they've been doing a lot of work with community and religious leaders from different language backgrounds, from that can tap into the different pockets of all of these areas that have been the most affected. Nathan, did you want to go into a little bit of detail about some of the work that the MRC has been doing?
Yeah, so when, hi everyone, firstly, thank you for inviting me on today. When there was initially, so it was about 2 or 3 weeks ago, but when there was some initial concern about Southwest Sydney, Fairfield, Liverpool and Canterbury Bankstown, we were called upon by Multicultural New South Wales to host a Zoom meeting with community leaders. And within 24 hours, I think we had somewhere, 300 or 400 registrations, and we had over 250 people turn up. And one of the people that actually turned up was the Premier. So it showed sort of very early on that the Premier was obviously quite concerned with what was happening out in this part of the world. But what we were able to do at that Zoom meeting was we had the Premier, we had a representative from New South Wales Health, and we also had the Assistant Commissioner. And what we're able to do there was, I guess, get the key messages out, but also have that channel back to the people that are, I guess, running this thing. So one of the concerns has been, there has been a lot of communication to the communities, but the communities are feeling frustrated in that if they want to feed things back, or they're not sure, or they're confused, or the translated services aren't making much sense, there isn't really those clear channels to communicate back. So this did provide an opportunity for that, and we're able to clear up some of the things which will probably come up in this Zoom meeting, which is stuff about the AstraZeneca versus Pfizer. Should I get vaccinated? What are the risks? I heard this on the internet. Someone sent me a WhatsApp message claiming XYZ. So that's some of the key stuff we've been able to clear up, but also just on a daily basis through speaking to people and speaking to community leaders, because as we all know, this is every day it changes, and there's new advice and new numbers. So I'll leave it at that.
Thank you. I guess the other component, part of the concern is now that there have been a whole range of people who are essentially unable to work. That puts a lot of pressure on them and their families in terms of access to food supply, access to transport, access to resources for children at home, and those sorts of things. And we don't want people within our community to be put in the position where they go against health orders and go into work, because otherwise it means they can't pay rent or they can't put food on the table. And that's where organizations like Uniting have been putting together, hampers and packs that are then distributed into the community. I've been in contact with the Hindu Council, who are looking to set up a hub to do a similar thing in Liverpool, because they're getting some requests from various parts of Southwest Sydney for people who are under significant financial stress and who do need access to this sort of support. So again, these are some of the things that we would like to support and see how we can do this in a safe way. I've been speaking with council to see how council resources can be used to, for example, be the site of a food hub to organise these things and provide those things. So that's, I guess, a little bit of an overarching summary in terms of some of the other considerations, rather than the coalface health response. As Nathan mentioned, some of the challenges have been not only getting the message and the information to communities, but also in challenging misinformation. So lots of people that I have spoken to in the last sort of 2 weeks have said that not only is official communication not really getting to members of their community, but just misinformation, things that don't make sense. There was a screenshot circulating on WhatsApp yesterday saying that grocery stores would be closed from tomorrow onwards, which is absolutely not the case. But it looks like an official screenshot of a public health order, and people think it's an official documentation. So what we're trying to do is also get accurate information out and make sure that misinformation isn't being spread further too. So I'll kind of leave it there, and we might open up to sort of some more discussion and questions and conversation about how we can do some of these things.
Yeah, thanks, Charishma. As I said, there are probably just a couple of other things to very briefly mention before we open it up to people. When we don't have an enormous number of people here today, so we could, you're more than welcome to put in your thoughts and questions in the chat for us to sort of respond to, or if you'd like to sort of wait your turn and speak, that should be fine. I'll probably take another 5 minutes and then we can have the discussion. So two things that I'd just like to quickly touch upon. One is vaccinations, and the other, the sort of the medium to long-term impact that lockdowns can have on all of us, and what kind of measures we can take to reduce that. So in terms of vaccinations, again, it's the very fact that it's a pandemic means that we can learn from the experience of everyone else as well. We're not the only ones in it. Southwest Sydney isn't, Australia isn't. The whole world is affected and has needed to sort of respond to this. And unfortunately, throughout, even though a number of different kinds of treatments have been tried, so far there is not enough evidence that a particular medication is effective all the time for this virus. Yes, the earlier you're able to get treatment, and if you get the appropriate sort of antiviral treatment and so on, and the supportive treatment, that most people should make a recovery. Unfortunately, what is also quite evident is the notion of long COVID, which means that you might recover from the acute infection, but have quite a lot of disability for a long period of time. So it is quite a significant illness. It is an illness that for some, it can come and go. For others, it can last. And for some, it has lasted for year and a half for some of them. And it could last even longer in terms of the various symptoms that they may experience. And at the moment, there is not one specific medication that you could say, yep, you have this virus, all right, you take this medication and you'll be fine. Absolutely. So in terms of a definite cure, or in terms of saying that, yep, even if you have the condition, no problem, there is this medication. Much like, say, for example, if you're bitten by a particular kind of snake, you can say that the anti-venom is available. And so therefore, if you get help at the right time, you have the anti-venom. And now what has Australia done? Australia has almost reduced the mortality from snake bites to being in the hundreds and thousands to being a few number. So there are it is still quite early. So we still don't have a specific cure. So not having the certainty of an absolute specific cure, we then go to the other kinds of measures. And the other measures, unfortunately, are only public health measures. What are the two main drivers of public health measures? Either reduce the transmission, which we are all trying to do, or prevent a person from getting it in the first place, or at least reducing the severity, which is the vaccination. So what does the vaccination do? Essentially, what the vaccination does is that it prepares your own immune system to be ready for when the virus comes. So if you are vaccinated, you're then ready for if and when the virus comes, your body will then recognize the virus as a foreign invader, and then mount a response so it won't prevent you from getting the illness, but it will reduce symptoms, and to a large extent may also reduce the ability for you to transmit it on to your loved ones. So from a wholesale population perspective, that has proven worldwide to be the most effective. So if you look at the UK, if you look at India, for example, and I think all of us have been know someone who's had COVID in India, and know someone who's sadly, we also know people who have passed away from it. So what we know from India is that mortality for those that have had both doses of the vaccine is negligible. So one thing we definitely know that having the vaccine will protect you from dying from COVID. Almost certainly protect you from dying from it. It will also protect you from getting a very severe illness, and it will also protect you from it will also reduce the chance of you transmitting it on to other people. It might not bring that risk to zero, but it will reduce it to a very great extent. And then in terms of types of vaccines, so there are a number of different vaccines available. So there's Pfizer, there's AstraZeneca, there's Moderna, there's the Sputnik one, there's the Chinese one, and there are a number of different, there's Johnson and Johnson. So there are a number of different vaccines available all over the world. In Australia at this time, we have two kinds of vaccine, Pfizer and AstraZeneca. Worldwide, the most common vaccine worldwide has been AstraZeneca. So almost all of UK, almost the entire UK, and now they have now opened up. Yes, they have increased cases, but their mortality rates aren't as high because a very large population has now been vaccinated. So almost all of UK is AstraZeneca. Most of Europe is AstraZeneca. About 2/3 of India is AstraZeneca. So there are many countries in the world, and most of the poorer countries in the world, like the Africas and some of those are also getting shipments of AstraZeneca as Indian production increases and comes online. Most of the other countries will get it from India. Australia also is producing AstraZeneca and has a huge stockpile of AstraZeneca. Unfortunately, the take-up here hasn't been so high, and so therefore the surplus doses are being sent to Indonesia at the moment. Pfizer was probably the first vaccine to be produced, and I suppose the difficulty with Pfizer is in cold chain transmission, which means that you need to be stored at a very a much lower temperature than you would than the other vaccines, making it a little more cumbersome and probably a little more expensive to ferry around. But that's also a very good vaccine. So if there are specific questions about vaccines, we can talk about it. But in terms of an efficacy perspective, they're both the same, or rather not only these two, but almost all the other vaccines at this stage, all of them have pretty good. We don't know enough about the Chinese vaccine, and we probably shouldn't go talking too much about it. It's unlikely to be available here, and unlikely that we have to worry about it too much. But the rest of the vaccines, there's been good evidence that they're all quite effective. In terms of side effects of AstraZeneca, I suppose that's the big thing that people are worried about. Yes, it does have sort of increased clotting as a potential side effect, and it is sort of in terms of risk, again, something that you ought to discuss with who you think is your best health professional to discuss. But risk is something that we take every day. I mean, I'm sure we all drive cars or get onto the road, and there is a risk that some other person could be drunk and could bring his or her car or truck in front of our car or a car that we are driving and cause a head-on collision and cause us to die or have impairment. And the risk of that happening is always there. The risk of perhaps going out on a stormy night and being hit by lightning is always there. If you go to the zoo, you won't venture into the tiger's cage, because there may be quite a significant risk of you being bitten by and maybe even killed. So you wouldn't take that kind of a risk. But if you have a significant headache, you'll probably take Nurofen. And I'm not sure whether you think about, well, can the Nurofen cause my kidneys to fail? Can the Nurofen cause a hole in my stomach and cause me to have gastritis for the rest of my life? Can I develop a reaction to the Nurofen and even die? I mean, you probably wouldn't think of all that so much. What I'm saying is that there are quite a lot of risks that we take all the time, and Pfizer isn't without any risk itself. There are some hard kind of conditions that can happen with the Pfizer injection as well. So it's important that you're aware of those risks when you take that. So essentially, if there are questions about vaccine, we can talk about that a little more. I also noticed that there are a few GPs here who would be used to talking about those risks with their patients day in and day out. So they can also respond to those questions if there are some coming up. But I think at this stage, from our perspective, the overwhelming recommendation is that if any of you here haven't been vaccinated, please be. So anyone over the age of, over the age of 16, Pfizer is available, especially if those 16, 17-year-olds are close contacts of people who are in high risk industries. But the AstraZeneca is available for everyone over the age of 18. It is available for, and most GPs would be able to talk to you about it. Obviously, in terms of recommendations and the TAGI, there has been some confusing messaging, and so that's caused, obviously it's caused a bit of confusion. But the recommendation at this stage are fairly clear in terms of who the vaccine is available for. Very, very few restrictions with regards to AstraZeneca. So it is available everywhere for everyone. With regards to Pfizer, because the supply is a little bit low, it's being controlled in terms of who gets it and who is eligible for it. And again, some of the GPs here can sort of answer, but the mass vaccination hubs that are providing Pfizer, because of the number of doses not being enough for the whole population, it's targeted at the moment. So not everybody will have a free choice. So leaving vaccinations aside, I mean, in a sense, I think the biggest message is that we should. So we all should get vaccinated. And if you haven't got vaccinated, then we should be, looking to make appointments. And then we can share some resources to where you can get AstraZeneca and where you can get Pfizer, or how you can go on to book them. We can share those around. And the other key message, I suppose, is that it's important that you transmit this message to everyone around, because ultimately the best way for us to, as a community, so both individually and as a community, to feel safe is to get as many of us vaccinated as possible. I'll briefly touch upon some other points of a longish lockdown, which we had touched upon a year ago as well. So we had mounted a response, and thanks Charishma for sort of mentioning about the Hindu Council and what they were doing last time. So quite a few of us here, together with the Hindu Council, a number of other organizations had mounted a response to help people with food, with shelter, with medical assistance, and also mental health assistance. And I think the same kinds of things will continue to play this time as well. There would be a lot of anxiety and worry and stress. There would be long lockdowns means children are at home, everyone's at home, people are at home more often than not, which could also lead to quite a lot of friction between people at home as to who has the computer or who has what space and so on and so forth. So that's something to be conscious of. Children learning from home, again, if schools are closed, then that itself will bring added quite a lot of stress on the parents and families. And also, if they're not able to then sort of work or have those difficulties, then those kinds of things will increase. There's also been noted last time as well that there was an increase in the incidence of domestic violence. And again, I think all of us, given that we have quite large community networks, we ought to be aware of and be sensitive to it. And if there's something that we suspect, then we should offer assistance as and when possible. So these are some of the more common kinds of things. But then I think if Charishma doesn't have anything else to say, we could open it up for the last, we have about 20 minutes to go. I'm sorry, I've spoken longer than what I intended. But if there are people, if there are questions that people have, or anyone wants to say anything, more than happy. I've just seen that Charishma has posted a couple of things there in the chat. But yes, so if anyone wants to go and in terms of asking questions, more than happy, you could speak up. I don't think there are that many people that we have to use the chat. So if you feel comfortable using the chat, you can. If there are any observations you have to make, or anything, even anything that you've heard people say or ask, please bring it up, because I think that's quite important. Yes, Sunil.
Yes, thank you, Dr. Jaram. Thank you, Charishma. Just for the rest of the forum who don't know me, my name is Sunil Vyas. I'm a GP in the southwest of Sydney. I'm also president of United Indian Associations of Australia, and I'm also past president of, three-term president of AIMGA, which is the Australian Indian Doctors Association. So it's great work you're doing, and I must commend you, Dr. Jaram. You summarized a very difficult topic very comprehensively and gave a lot of very useful information. Just a couple of things to, one is a query, and the other is just to reinforce what you said, and third is just a plug for some useful community information. So first of all, if people can put in chat, I'm interested to see what sort of vaccine hesitancy there is, or what sort of wrong ideas there are in the community. Because I was always under the fond impression that the Indian community is very open to taking medication and vaccines as prescribed by the scientists and the medical practitioners. But recently I came across some situations where there was a lot of vaccine hesitancy and actually wrong impressions. So I'm just open to know what type of experience and thoughts people have, or within your context that you have. Second thing is, I would like to reinforce, and even though it may seem repetitious, I think it's such an important message. I would like to reinforce what Dr. Jaram has said, that the way for us to get out of this is to get vaccinated. It's so important. And there is such a lot of false information. And every day I come across people who first thing they talk of it, oh, but the blood clot, and oh, I'll wait for the Pfizer vaccine, not realizing that we are in a dire situation at the moment. The quicker everyone gets vaccinated for their own self, as well as for their family's sake as well, that's most important. And just to put it in perspective, everyone worries about the blood clot business. As Dr. Jaram said, that you go out every day in a car, not realizing how dangerous that is. From the last year's statistics, I worked out every day in Australia, 4 people die from a motor vehicle accident every day. Put that in perspective with the blood clot from AstraZeneca vaccine. So far, there have been about 6.5 million vaccine doses given out. And so far, there's only been about, the last I heard was 7 or 8 people who had actually died in the whole of the last 6 months. And of the people who actually got the clotting disorder, it was only about 80 something in the whole of Australia. So it's vastly different what the risk level is as well. So people should unhesitatingly go for it and get vaccinated. I myself have had the AstraZeneca. My colleagues have had the AstraZeneca vaccine, no problems, no worries. So you should be going for that. So it's a false perception, and unfortunately, the media always keeps blowing up the risk of that and not keeping it in perspective. So it's very important you encourage everyone, your friends, relatives, to go for it as well. Same Pfizer vaccine, if and when that comes along, well and good, but that has its own side effects. But again, don't worry about it. At the moment, the crisis is, there's a fire going on. You try and put out the fire. You don't worry about a little piece of furniture you might have in your back room. Most importantly, save yourself and save the house. That's the type of situation we are in. So that's why I've like, thanks for your message, Dr. Jaram, and I'd like to just reinforce that as well. And in view of the importance of the vaccine, we at UIA, at United Indian Association, we actually started what we call the 3P initiative. With that, what we are saying is we just have given out a simple message to the communities to encourage vaccination, which means 3P standing for 1, protect yourself and your loved ones, 2, protect your community, and 3, protect your nation. That's the simple message, saying that, and in a 2-minute video clip. So I request everyone here to actually go onto YouTube, look up United Indian Associations, and there's a message from me as president of UIA, but also we've started rolling out messages in different languages. And our idea is that giving a message, a health message in your mother tongue and coming from a health professional will actually give a lot more trust and faith for the people who are listening to that. So if there's vaccine hesitancy, we can actually encourage a lot more people like that. So we're going to be rolling out that message in different languages. Unfortunately, because of lockdown, it's a bit slow for us to roll it out. Already, we put it up on YouTube the other day with my message in English. You already got a message in Punjabi there. We'll be getting messages in different regional languages, all said by a health professional. So I request everyone to share that message for the greater good. It's nothing for us, it's just a community service we are doing. So that's what I wanted to share with you. And I'm welcome to any suggestions, questions or so as well. Thank you.
Thanks, Sunil.
Can I just second that comment? There's some early research coming through from the Western Sydney Migrant Resource Centre, where I'm the chair. They've done some surveys and they're speaking to the community, and what they're finding is that the community most of all trusts community leaders and their GPs. You can get a message out from Multicultural New South Wales or Health New South Wales, but for many in the community, they're sort of very sort of faceless and up here in terms of messaging. If it's coming from your community leader, if it's coming from your GP, there's a much higher level of trust. And I think that's certainly one way to counter the misinformation and to push people that little bit they need to be pushed in order to go out and get vaccinated. So certainly agree with that comment 100%.
That's a very good point, Nathan. And I think that's typical of most communities, especially ones like ours that's quite intertwined and so codependent and has been the bedrock. So it's a significant strength that there are a number of different connections that people do make, and really it's really, really important that the advice comes from both professionals and community leaders. Absolutely. No, thank you for that. Because that's something that we see quite often. I mean, I think all of us have experienced, whatever difficulties we have. If there's a car problem, yes, we would take it to the mechanic, but we'd also have a chat with a trusted friend to say, hey, this is happening. This is what I'm intending to do. Is that the right thing to do? Or if you're taking medication, you might, or if you're ill and you've been advised to take some medication, you might also try, call your trusted uncle or an elder in the home to sort of cross-check to see whether that's what they would also recommend. At least me being in the mental health field, I've found 100% of all my patients also seek the assistance of who they trust with their own cultural group. So it's quite ubiquitous.
Can I just ask the GPs who are in this discussion, are you up when patients come to you for consultations, whether it be related to COVID vaccinations or any other matters? Is there, do you have a discussion about vaccination with patients, or is it just if they ask the question or raise the topic themselves that the conversation comes up?
Hi, Charishma. This is Sindhu here. Yeah, so we opportunistically always ask them and encourage them to have the vaccine. Yeah, just when they come in for vaccination.
Excellent. I'm just hearing in terms of communities in Southwest Sydney that there's a lot of sort of people from a Fijian Indian background who may not be opting for the vaccine and that sort of thing. So I'm wondering if that might be reflected in the experiences of GPs or other medical professionals who are working in Southwest Sydney.
So in our practice in Westmead, we mainly see people from our community, South Indian, and mainly Indian community. They're quite open to have the vaccination, but with the AZ vaccination, it's still a lot of hesitancy, even in patients who are over 60.
Yeah, thanks, Sindhu. And I think that's something that as a group we have to push in that these are dire times. These are times where there's a lot of community potential for a lot of community transmission to continue to happen and even increase. And really the best way to quell it and the best way to prevent further lockdowns is vaccination and whatever is available. So I guess I think that's one message that we ought to push. I'm aware that we just have another 10 minutes or so for this chat rooms, and there are a number of people who haven't said anything. So if there's anyone who'd like to ask or say anything, please, I would welcome them to do so.
I do have a question. So you mentioned about 16-year-olds plus can go in for a vaccine. Is that open for all, or is that encouraged specifically for frontline or people? 16.
Yeah. So at the moment, there have been some local health districts. So all of Sydney is divided into different health districts from an administrative perspective, and generally all of them have hubs where they do administer the vaccines, including both Pfizer and AstraZeneca, and those hubs have opened up the vaccinations for over 16, but in this instance over 16 if they are family members of health professionals or family members of people working in the health or certain industry and so on and so forth. But otherwise, the general recommendation for the general community at this stage is that 18 plus, although the most recent recommendation is that Pfizer is safe for 12 onwards. 12 onwards. But the supply of Pfizer is the issue at this stage. So it's
not rolled out yet for 12
yes.
over, but PGA is approved.
Has approved.
Use.
Yes.
But yes, as we get more supply, probably they open for that age group. Initially, it will be for those who have underlying medical condition or immunocompromised, and then probably down the track, other kids will get it. But to start with, those are the kids who's going to get. But yeah.
Meenakshi, I think you had a question.
Namaste to everyone. What percentage of the total community is got vaccinated in Australia or in Sydney?
Yeah, so that's a very good point. I don't have exact figures, and obviously
I think over the age of 70 or 60, it's 30%. But overall, who have got both the doses, it's only 14%. Yeah.
What is the target? When are we reaching 50%?
Oh, that's a good question. We are trying to get to that, but I think that's the purpose of this forum, I think, to encourage everyone to have whatever vaccine they can get hold of, so that we can get there quickly.
I've got a question on the Pfizer vaccine. They're talking about first dose now and second dose after 6 weeks or something. If they kind of not able to get the second dose within 6 weeks or something, what happens to the vaccination sort of efficacy and things like that if it is delayed even further until they get the stock or second dose? So some of the eligible people are asking this question. First dose is fine, but if you're not getting second dose in 6 weeks, what happens?
Yes. So we automatically, when the patients come in for the Pfizer dose, we automatically book in for the second dose as well to make sure they get the second dose. At this stage, whatever we have done last week, we have done after 3 weeks, they're already booked to come and get the second dose. But from now on, I think it will be pushed it will be 6 weeks apart. But that appointment will be made at the first instance. So we know that they're going to get it.
There won't be an issue, Ramu. There won't be an issue.
That's how we make
as Sidhu said,
Sorry,
that
okay. Sorry, this is Rupashri here. I'm a child psychiatrist too, but however, from the evidence from the other countries, so far suggests that duration between the vaccinations is not severely impact the illness or the getting the illness. There is a decrease in about almost 30 to 40% by taking even one dose. A delay is not going to affect the efficacy when you take it next.
Yeah, thank you. Vinod, I think you had a point.
Yeah,
I think
actually, yeah. Can I jump in? Can you hear me? Yeah. No, I got a suggestion to make. Why can't in next meeting or week after, why can't we involve different committee leaders from Nepal, Bangladesh, Afghanistan, and from different countries, so we can get the community leaders get all in our meeting, and we can tell them to communicate in their community properly, so that more people can get vaccinated. I'm not sure, because as far as I know, we Indians are pretty confident. More than 75% have been vaccinated in my circle, whoever I know. Yeah. I think the problem lies in Nepalese community or Lebanese community about the vaccination. It will be good if you can invite those leaders in this meeting like this, and we have to talk with them and try to communicate like what's happening, so that we will have a better picture.
Yeah, that's a good point, Vinod. And yes, so if you do have their contacts, please let us know, and we're happy to extend.
About that, myself, I will do it, and even Charishma and Mr. Nathan can have a look about it, so that they will have a good contacts in the community. It will be a very good use if we do that, actually.
Absolutely, absolutely. The more people we can reach, the better. Yep, thank you.
I think going back to Nathan's point earlier about the community messaging, just as they're hopefully getting messages from community and religious leaders about the importance of vaccination and getting tested and adhering to the restrictions, I think it's also very helpful getting the same message from other parts of their network. So if you have co-workers, if you have neighbors, friends of your children, people who you would see regularly in different parts of your life, passing on this message to them is just as important as members of our community, I think. So getting that message from not just people from a similar cultural background, but also people you work with, who you live next to, your kids' friends, parents, and things like that. That's also part of the messaging. So I'd encourage everyone in this conversation as well to spread that message more widely too.
I've got a question for Sindhu, especially on the Western Sydney and side of the community. A lot of young generation who are below 40. That's what the things are. We opened up Pfizer for them to get vaccinated, or is there sort of a criteria for them to get eligible to get the Pfizer vaccination if they're below 40?
So if they're below 40, so not everyone is eligible at this stage, but if they're a healthcare worker, or if they're if they're a disability care worker, there are certain, I can send out that list to everyone if you like, but at this stage, not everyone is eligible, but certain groups are eligible. Pregnant women is one of them, which is now recently added to that list. Yeah. But I can send out that whole list for everyone to look at.
With the last couple of days or a few days back, when Dr. Chan on the media, she said there will be a lot of focused on Western side because of the younger population.
Yes.
I was hoping that could be changed because some of the, not some, or quite a lot younger community there, and they wanted to get vaccine. Not ready to go for AstraZeneca, but wanted to wait for Pfizer. Just really getting stressed out. They're not able to get the appointments, or not eligible as well. So that's where the biggest stresses exist in the community.
Yeah, that's why they are encouraging everyone to consider AstraZeneca, because there's a lot of supply issues with Pfizer.
Yeah, there's no. Anyone
Yeah.
over 18 can get the AstraZeneca, and that is sort of
Yeah.
freely available with most GPs. So Rama, I suppose in this quite significant situation, if the community spread continues to go unabated, I think the strong advice is that if you're under 40 and there is quite a lot of community transmission happening, then you're far better getting AstraZeneca and protecting yourself rather than waiting for the Pfizer and exposing yourself for a chance to get COVID itself and have the rest of the complications associated with it.
Yeah, agree.
As Dr. Sunil was saying, a lot of GPs who are less than 40, they got AstraZeneca in the beginning before they changed the recommendation. So as we've been saying, the risk is still low.
Yeah. Look, I agree from a discussion point of view, but human nature is quite optimistic. They feel that they don't get it until they get the Pfizer vaccine. That's the problem.
No, that's right. So I suppose forums like the question is that if there is a lot of hesitancy with regards to AstraZeneca, and they want to have a discussion. I mean, obviously, if their minds are made and they don't want to have it, you can't prevent it. But I guess it's all of our responsibility to do that. And as I think Dr. Sunil Vyas said, I mean, he's had it. And I know, I mean, for myself, lots of our family members have had it. In India, my parents, my in-laws, all of them have had AstraZeneca. So I know a number of my cousins who are younger than me have had AstraZeneca. So it's something that all of us have had experience of, either directly ourselves or our loved ones. So if it is possible for us to be in touch, or for them to be in touch with appropriate health professionals, then we should push for this, because really it's something there, it's something available, it's an easier way out of this current problem. And if we continue to wait for Pfizer, then for some, the wait unfortunately will be too late.
Yeah.
For some.
There is one in Macquarie Fields, they opened that Pfizer. You can book, you will get as early as possible. Even so some of my friends booked there.
Yes.
So they're getting, next week only, they're getting all the vaccination. If anybody wants, they can book straight away there,
Yeah,
they still have to meet the criteria.
Correct.
Less than 40 is still not everybody. Can get.
And thanks, Ramya, for posting your message about being fully vaccinated with AstraZeneca, and he's fine. And as far as we can see, he doesn't have any clots.
Do we want to get?
So Ramya was actually in our clinic for the vaccination.
Right.
If we had planned before, we could have had a poster picture for
Ramya. We should.
And circulated it around.
Yes.
I was like, I told Naveen, I missed the chance. I didn't know he was coming.
I'm sure there's no reason why we can't simulate the photo again.
We can.
I thought about it. But
Ramya, for the over 40s, he's just turned 40 last year. And then Sarishma, for the under 40s, she's half the age.
There was also a question just before from, I think, Sureshji, about anybody having approached for assistance, if people wanted to quickly share about that. On my end, I can update next week when we've had a little bit more discussion with the Hindu Council and what we can set up in Southwest Sydney. But if anyone would like to highlight any areas of need or any specific things that they have been contacted about that we can assist in organising, that would be fantastic. And I just saw Manjuji's also.
Manjuji, you want to ask something? Yep.
Yeah.
Yes, Manju.
Namaste. See, we have shakas runs in throughout Sydney and Newcastle. We have 17 branches in Sydney area. Whatever we are doing, like last 2 weeks, 2 Saturdays and Sundays, and our activities runs on Saturday and Sundays. And we, after the Shaka, so we are asking everyone, like, did you get a chance to get a vaccination? Means like as a community people, we had to ask them, like if they're not taken a vaccination, ask them to, we are asking them to take vaccination. Means that is the good way to encourage the people to take vaccination, because we wanted to go back to Sangastan, like a physical activities. Like every Shaka, they want a physical activities. That's why we told you, like, get vaccination very fast and we can go back to Sangastan. This is what we are doing in the Shakas.
Very good message. Very good message. Thank you, Manjuji. That's very good. I'm conscious we have sort of gone a little bit over time. Jesse, yes, you had a question?
Yes, I do. I think majority of my friend circle is under 40s though. I think there's conflicting messages when you have a look at these press conferences that keep happening every day at 11, which I'm kind of glued to. There's kind of conflicting messages in there to say, if you're above 18 now, you're open to either AstraZeneca or Pfizer. But yet I think, the common message I'm hearing now, at least in this group, is it's still not open. So is that a difference in how the messaging to the GPs are being reached at this stage, or is that the ground reality versus what's being said? Because the thing though is, I've got a couple of other friends who are probably in and around Dubbo and Orange, and they wanted to see if there is any reach from a GP network perspective as what we shared the other day, to say the X amount of clinics. I think it's a twofold question. The first is it available for under 40s? One, because majority of my friends are there. And are there any GPs that we can include in our circle that can go near Dubbo and the other areas as well?
So do you want me to answer, or Raju, you can answer?
Yeah, I can have a go, and then Sindhu, you can continue. So no, the messaging isn't it is really unfortunate that it has been mixed messaging, but the underlying message is fairly clear. So in terms of vaccine availability and recommendation, is one thing. So in terms of overall safety and recommendation, so at the moment 12 and over, Pfizer is recommended, and 18 and over AstraZeneca is recommended. As in it is available, it is safe and can be used. The problem is in terms of supply. So while AstraZeneca is freely available, and so therefore anyone 18 and over, if they would like to have it, can have access to it and have it. Because the supply of Pfizer is limited, what the government is doing is targeting Pfizer for those groups that are at greatest risk of dying from COVID or having a significant negative morbid kind of reaction. And so only certain age groups, certain special populations, so on and so forth, are being targeted only because the supply of Pfizer isn't as as much as the supply of AstraZeneca. Sindhu, did you want to add anything to that?
Yeah, with the TTS or blood clot with AstraZeneca, certainly it's slightly higher risk for younger people. But now with increase in cases, without having any vaccine, the risk, like if you catch COVID, the risk of having blood clot and hospitalization and death is much higher. So that's why the ATAGI has changed the advice, saying strongly consider any vaccines that are like for under 40. So you can't qualify for Pfizer, so take AZ.
So just on that though, thank you for the answers though, but just on that, what is the, when you say you don't qualify, what is the qualification though? Like there's no clear guidance as well.
There is so there is a list that I can send. So for under 40 who qualifies for Pfizer at this stage, but not everybody is on that list, unfortunately.
So I get that. As long as we've got that list of, I think amongst our group or friend circle as well, though, everybody is encouraging everyone to get vaccinated, but then yet, like, a couple of them got through with this new Macquarie Fields vaccination center going in. However, a couple of them haven't, obviously, because one in their household has been vaccinated, and that's why. But the common questions is, if it's so haphazard, and there are certain questions amongst our group itself who say, if we take it, are we going to be taking it out from the community who are older? Like, when I say older, not respect to anybody here, but if it's at a, more than 40s, that is a question they get asked as well. It is a very difficult question. Question to answer. Like, if someone 38 wants to take a vaccine, but is actually holding back because someone's there, is going to take off a chance for a 50-year-old later on or something.
So if you're under 40 and if you come under that high risk, so criteria like priority group, so you will get Pfizer. But if you're out of that criteria, like I know people like who are just didn't have any appointment, just turned up at Olympic Park, so happened to get the vaccine, because once they open the vial, if there is anything left in that, they'll give it to someone. So people have had that, but now there is supply issues, and under 40, if they don't meet criteria, it's hard to get it. So consider AstraZeneca.
You're on mute, Rajiv.
Irappa, you had something to ask? We still can't hear you. No, we still can't hear you.
But did that answer your question, Jaisim? Or?
We still can't hear you, Irappa.
Okay, yeah.
Yeah, we haven't got to the double question for Jason, but we'll come back to that. I think we only had something to ask in Irappa as well, but Irappa, we can't hear you.
We can.
I'm not sure exactly why.
Now we can hear you.
Can you hear me now?
Yes.
Yeah.
Yes.
Okay. Sorry about that. The ground reality is people who have just gone into the system and booked have been under 40. I know about half a dozen people who have got the Pfizer vaccine without coming under any priority category.
Yes.
So most of these people whom I know, that is including my son, who are not coming under any priority category, they have just gone into the system, booked themselves, and they have got the vaccination. So I'm not entirely sure as to why most of our people who are under 40 have not been able to do that.
Yeah, I think those who got, I think that's how it has happened. So those who have turned up at the vaccination hub, if they had any doses left and they didn't have anyone to give it to them, so they've given it to them. So
no, these ones have directly booked on the system.
It was booked, though they didn't meet the criteria.
Yes, they didn't. They have no special criteria, but they have booked and they have got it.
Oh, I don't know how that could have happened.
And I also know some people who have just gone to the Westmead clinic and logged on to the app from there, as in the QR code from there, and all of them have been able to get Pfizer.
So we actually, when they come to GP clinics, we actually go through their eligibility criteria and make sure they're eligible before we give it to them. If they had it outside that priority group, I don't know, I can't answer.
Yeah, I was surprised too, but I know, as I said, half a dozen of them, including my son, who have got it without any priority in the list.
You're lucky.
To be honest, everything which is available becomes flexible at some point, and a lot of things are not exactly gone by the books. Several people are comfortable doing that. There are other people who are not. The system also probably works around the same thing.
Yeah, so as Terry Chang was saying, take every opportunity to take the vaccine. So people are used to.
Thank you. We should be wrapping up in the next 5 minutes, maybe just a couple of questions. Vinod, you had something?
Yeah, as per what Mr. Veerappa said, I absolutely agree with them. When we sent our first, about 2 months back, we sent a link in our notice board telling that the vaccination has been given. As far as I know, more than 20 people booked using that link, including a lot of age group between 25 to 30, like Bhavana and many people, like many teenage girls and boys. And they've been vaccinated for below 30 years of age using that link. Yes, I agree with Mr. Veerappa. It was possible last month.
Yeah, I think it was possible last month because not many people were coming forward. Now with a lot of people coming forward for Pfizer, I don't think that will happen now.
They did change the booking system as well in between. I think 5th, they changed the booking system, and they also changed the booking system upgradation, the system software, how it works and things like that. Before it was some sort of a loophole was there, not anymore. That loophole is there in the system.
Yeah, so one last comment. Kruti, I think you had one.
Hi, my question is first dose of vaccine, if you take either AstraZeneca or Pfizer, and the second, if you go to, switch over, like first AstraZeneca and second if you take Pfizer, or vice versa, is there any impact on our, the body system or something?
No, I think Kruti, now they're actually saying we can mix the brands.
Okay.
Before they said if you had AstraZeneca, you can only have the AstraZeneca second dose. Now I think the mix and match is going to happen.
So again, duration would be like 3 weeks, is it?
I'm not sure 100% on that, but I'll get back to you. I've got some resources just on that, but I can get back to you on that in more detail later.
Yeah. All right. Thanks all. I mean, it's been wonderful to have such good, lively discussion. So I think only one answer was pending, and that was Jason's about the GP resources in Dabo, and we'll get back to you, Jason. So Sindhu, if you have any, or I can also check in terms of the of that in Dabo. So we'll get back to you on that.
Yeah.
But many thanks for all of you to have participated. Some had to leave at 5, and thanks for their contributions as well. And this is something that we hope to do on a weekly basis. So please, there'll be many different scenarios and questions and things that will come up. And Charishma, lots of members of this group also had participated in the first drive with Hindu Council as well. So I think whatever is happening, it's good to involve sort of maybe Vinod as well and a few others, because then it can be a local kind of a response where the presence of a number of Friends of India volunteers is quite high as well. So I think it's timely, and as Manjuji said, there are quite a lot of sort of shakas running and people that we can include from there as well for the and Rajni has put in a message as well to say that she is happy to be part of that. She was very much part of the first drive. So I think another concerted joint effort is probably going to be the best. So from my perspective, I thank all of you for having participated and contributed to this, each and every one of you. It's been a pleasure to be part of this first chat room, and essentially we hope to do this sort of regularly. And in the lockdown world, it's also a good time to come and say hello to each other and see each other's faces. We don't do that very often these days. So even that would be even if it's only a function of coming and saying hello, even that is well worthwhile. But Charishma, I'll leave you to say the last few words before we wrap up for today.
Sure. I mean, I can't add
and
much
also, I think you can also talk about the program that's coming up in a couple of weeks' time.
Yes. Look, I can't really add very much to what Rajiv said, but to also include my thanks to each and every one of you for coming along and contributing and asking some very very necessary questions, and to the doctors and others who contributed your knowledge and information. Thank you also for participating. As Rajiv mentioned, in 2 weeks' time, we are running the third in our series of health talks. So this one will be about stress and managing, managing whether it's daily stresses or situational stresses that we're experiencing. We'll have, again, a panel of different health professionals who will be contributing their expertise in this area. So it will be the same time as this, 4 to 5 on the 8th of August, which is not next Sunday, but the Sunday after. As we were talking about initially, this is hopefully the first in a weekly series of community forums. So we'll be organizing and sending out the details for next week's community forum as well. So please feel free to share with other networks that you're part of. I know with 2 other local government areas who are now experiencing the same level of restrictions as Southwest Sydney, some of what we have discussed here might be of use to people in those areas, and they may also have questions and considerations that they want to to discuss with us as well. But by and large, I think this is a great space to hopefully check in with each other and have something that we can do on a Sunday afternoon to connect with each other. So again, thank you all for coming along, and I will see you next week. Bye.
All right. Thank you. Thank you, everybody.
Thank you, everybody.
Thank you.